Hi there, welcome back. Let's review diabetes insipidus, or simply speaking DI today. This DI is something that when your body cannot regulate how it handles the fluids. So simply speaking, it has to do with the hormonal abnormality, and it has nothing to do with the diabetes mellitus, type 1, type 2 or glucose intolerance that we have discussed before. So make sure that you know the difference between the two. That diabetes is altogether different than DI that we are referring here. What happens is this, that our kidneys filter the blood many times throughout the day, and in the process it will reabsorb the water, but something that remains, that is excreted through the urine in a concentrated form. However, in the event of DI, what happens is this, that kidney does not function properly, and as a result, instead of excreting the concentrated urine, it will release large diluted urine. So that is what the DI means. Now let's try to understand some of the basics here. What happens is this, that the amount of water excreted in the urine is controlled by ADH, antidiuretic hormone. It is also known as vasopressin. What happens, this ADH is produced in a part of the brain called hypothalamus, and actually it is then stored and released by pituitary gland located below the base of the brain. So here I have put down central DI, also known as neurogenic DI, and nephrogenic DI. Simply speaking, nephrogenic means related to kidney, but let's first focus on central DI. So central DI is also known as neurogenic DI. It has to do with brain, the neuro it all starts from. So if the DI is caused by lack of ADH, then it is called central DI. I repeat, if DI is caused by a lack of ADH, it is called central DI. Whereas if DI is caused by the failure of the kidneys to respond to the ADH, then it is called nephrogenic DI, because it is related to kidney. Kidney is unable to respond to the ADH, and that's why we are having that nephrogenic DI. So now let's make an attempt to look at the causes of the central DI. It could be a genetic problems, it could be due to the head injury, it could be because of infection, loss of blood supply to the pituitary gland, surgery, or maybe the tumor in or near the pituitary gland. Nephrogenic DI involves a defect in the kidneys. As a result, the kidneys don't respond to the ADH. Like central DI, nephrogenic DI is also very rare. As far as the causes of nephrogenic DI, it could be because of certain drugs such as lithium, or a genetic problem, or high level of calcium in the body called hypercalcemia, or a kidney disease such as polycystic kidney disease. So these are the causes about nephrogenic and or central DI. Now what are the symptoms? The symptoms are excessive thirst, excessive urine volume, excessive urination, even often needing to urinate every hour throughout the day and night. So those are the symptoms that we would see in a DI. What are the exams and the tests that doctor will do? The doctor will look at the medical history and the symptoms and all that, and the test that he may be performing includes the blood sodium and osmolarity, MRI of the head, urinalysis, urine concentration, urine output. These are the possible tests doctor may conduct to arrive at the better treatment and the course of action that needs to be taken. So how about the treatment? As far as the treatment goes, depending upon the central DI, let's first talk about the central DI. The vasopressin is the one. The central DI may be controlled with vasopressin, and it can be administered as an injection, as a nasal spray, or as a tablet. As far as the nephrogenic DI, the treatment goes, let's say if it is caused by a certain medication, right? Then stopping that medication may restore the kidney to function properly, and that may resolve the issue. But there are times that if medications have been taken for many years, then unfortunately the impact could be such that it may remain permanent. So that's about the treatment. As far as the hereditary nephrogenic DI, they are treated by drinking enough fluid to match the urine output, and plus on as needed basis, the medicines that lower the urine output can also be taken or given by the doctor. Now, nephrogenic DI is treated with anti-inflammatory medicines and diuretics like water pills. So that's how it goes. The prognosis not that concerning, as long as if treated properly in a timely manner, it does not cause severe problems, generally speaking. However, there could be complications. The best thing to do is correlate all the details that you get from the medical records, follow your company specifics and the underwriting manual that your company expects you to follow. Okay? With that, let's take a break and see you soon. Take care. Bye now.